Thank you. I thank the gentleman for yielding, and I thank you, Madam Speaker. I rise today to bring attention to the consequences of the drug pricing bill H.R. 3. There is no doubt we must act to lower prescription drug prices for Americans, and for Americans to only pay their fair share. However, this bill is not the right path. We often hear stories about the way that other countries pay for their drugs and the country's payment systems. What you don't often hear about are stories about patients who are unable to receive care and access to life-saving drugs because of limitations in their country. For Louise Morehouse, we have examples of how much fewer are offered in these other countries, but it's personal. For example, for Louise Morehouse, as a teacher in England, hope was in the reach when she enrolled in a trial for Kuvan, a drug used to treat PKU, a rare genetic metabolic disorder. If left untreated, the disease can result in mild to severe neurological issues. When Louise was in the clinical trial for Kuvan, she was able to eat and function like anyone else. Sadly, Louise discovered after the trial that the drug that helped her live a more normal life was not covered by the United Kingdom's health service, despite the agency's acknowledgement of the drug's efficacy. As the drug is not covered by the NHS, she no longer has access to this drug and is returned to taking 80 pills a day in conjunction with a highly restrictive diet instead. In the United States, we have access to innovative drugs, and the key word is access. When people talk about H.R. 3, what they want to say is that we can completely transform the way we pay for drugs and never talk about or never even acknowledge the way we completely transform the way we receive and have access to drugs. We know that. The Congressional Budget Office, there's other studies, we could lose 100 different cures that are coming down the path. So as Americans want relief from the prescription drug prices, Americans also want access to these innovative drugs. President Carter is alive today because of access to one of these experimental drugs that are becoming lower cost and more affordable for everyone. My point is that there doesn't have to be a choice. We can have both. We can have lower prices and not completely lose access to these drugs, not lose access to these drugs and continue the great innovation that we have. And that choice is H.R. 19. It's a bill that will be on the floor tomorrow. Every bit of it is bipartisan. Every single piece of it has a Republican and a Democrat co-sponsor. It is something we know the Senate will take up and the President will sign and give relief to the American people and continue to give access to the great innovations that we have. I hope that we can take that bill up tomorrow, and thank the gentleman for yielding, and I'll yield back.